is the stroke scale used in emergency rooms. When someone shows signs of a stroke, time is critical. One of the first steps in emergency rooms is to assess the situation quickly and accurately. So, is there a specific tool for this? Yes, stroke scales are routinely used in emergency rooms as essential tools for identifying and assessing stroke in patients. One commonly employed scale is the recognition of stroke in the emergency room scale, often referred to as the ROSIER scale. This scale includes 7 clinical items that evaluate neurological signs and patient history. It helps healthcare providers differentiate between actual strokes and conditions that mimic stroke symptoms. The ROSIER scale gives a score that indicates the likelihood of a stroke. If a patient scores above 0, it suggests a probable stroke, which leads to further urgent evaluation and management. However, it's important to note that while the ROSIER scale is sensitive and valuable, it cannot definitively confirm or rule out a stroke on its own. It must be used alongside a thorough clinical assessment and imaging studies like a CT scan or MRI. In addition to the ROSIER scale, other stroke scales are also widely used in emergency settings. The face, arms, speech, time test, commonly known as the FAST test, is often applied in both pre-hospital and emergency contexts for quick stroke recognition. This simple test helps identify stroke symptoms by asking the patient to smile, raise both arms, and speak a simple sentence. Within hospital settings, including emergency rooms, the National Institutes of Health Stroke Scale, or NIHSS, is the most recommended tool for evaluating stroke severity. The NIHSS quantifies neurological deficits and is crucial for guiding treatment decisions. For patients who may have altered consciousness, the Glasgow Coma Scale is frequently used to assess their neurological status. Emergency departments have protocols in place to rapidly triage and evaluate suspected stroke patients. They prioritize immediate assessment of airway, breathing, and circulation, while also expediting diagnostic imaging to confirm the presence of a stroke. This is vital for determining eligibility for treatments like thrombolysis or endovascular thrombectomy. Stroke scales like ROSIER and NIHSS play a key role in this process, ensuring timely and accurate diagnosis and management decisions. In summary, stroke scales are standard and critical components of emergency room care for stroke patients. They enable healthcare providers to quickly identify strokes, estimate their severity, and prioritize urgent interventions. This rapid response is crucial for improving patient outcomes in acute stroke management. Always remember, if you or someone else is experiencing stroke symptoms, seek immediate medical attention.